So, our topic for today's case presentation is about Class 1 spacing. So, spacing is a common condition for pediatric patients. It constitutes a very important feature of dentition for the favorable development of permanent dentition. Spaced dentition is characterized by interdental spaces and lack of contact points between the teeth. Spacing can be classified as localized or generalized due to the number of teeth included. It is a common aesthetic problem for many patients. So, as you can see here is an illustration of such class 1 spacing. On the left side, you can see localized, gaya ng pagkaka-describe kanina. Depende siya sa number of teeth involved or included. So, sa localized ay between central incisors lang siya. So, sa generalized naman, as you can see, kada ngipin or kada interdental space ay meron siyang gap. So, mas maraming teeth involved or included dito sa generalized compared dun sa localized. Teeth spacing can be caused by thumb sucking and tongue thrusting during childhood. Microdontia or the occurrence of small-sized teeth. Some children are born with missing teeth, which might result in tooth spacing or greater interdental spacing. So here are the etiology of spacing. First, we have the tooth size. It is the jaw size discrepancy. So, ano nga bang ibig sabihin nitong jaw size discrepancy? So, come to think of it, kapag ang patient ay merong bigger jaw or mas malaki yung jaws niya, upper jaw or lower jaw, which kahit ano doon, mas malaki yung tendency na magkaroon ng spacing sa bawat ngipin niya kasi mas malaking space or larger yung space na i-compensate ng ngipin. So, pangalawa is yung congenitally missing teeth. Gaya nitong patient namin, mamaya describe namin kung bakit or ano yung congenitally missing niya. Which is yung dalawang lateral incisors niya. So, nagkaroon talaga ng space dun sa anterior teeth niya. Next is macroglossia. Macroglossia is a big tongue. Alam naman yun. Bigger tongue than normal. It contributes to spacing. It causes protrusion of jaws. It compromises stability of ortho treatment that causes to an anterior position ng mga ngipin. So, nagkakagat yung ngipin niya kasi parang natutulak nung tongue forward. Yung pang-apat naman is yung tooth or teeth anomalies, peg shape or microdontia. So, pag microdontia, alam niyo naman, maliit yung ngipin. Tooth abnormality, kapag peg shape, alam niyo na din yan. So, nakita niyo naman, di ba, gaya nun sa, example lang, yung sa resto natin, di ba, malaki yung space niya kapag may peg shape laterals yung ating patient. So, panglima is yung deleterious oral habits. So, na-discuss naman na to, no? Nung mga oral habits na nag-report. Pwede siyang generalized spacing or localized spacing, gaya nung tinuro ko sa inyo kanina. Usually, anterior teeth yung involved dito. Next is yung pathological causes. Yung acromegaly, cyst, tumors, ganyan. So, yung acromegaly, myxedema, tertiary syphilis, tumor, cyst, it affects the tongue and the nerve injury, no? So, nakita nyo naman, di ba, halimbawa, yung mga pathological conditions na sinabi ko sa inyo nito. Di ba, yung nagdi-discuss sa atin, nung pato is, yung pagka nagpapakita sila sa atin ng radiograph, merong may mga tumor or cyst, so nagkakaroon ng spacing dun sa ngipin. Kapag masyado ng large yung tumor, masyadong large yung cyst, nagkakaroon ng spacing between teeth. So, next is loss of tooth or teeth due to extraction. Alam nyo naman na kapag may binunot tayong ngipin, so nagkakaroon siya ng space dun sa ating arch, mapa upper man or lower. Next is delayed eruption of permanent teeth. So, kapag natanggal na yung deciduous teeth, and nagkaroon ng delayed eruption yung permanent teeth, so may space siya na nag-o-occur, diba? And next is yung aggressive periodontitis. So, ito, alam naman natin ito kapag nag-x-ray tayo pag perio patient, lalo pag yung case is, or diagnosis is aggressive periodontitis, ay meron siyang spacing. Dahil meron siyang rapid epithelial attachment and bone loss na nagkakos sa spacing. So, here's the case presentation. This is our patient's profile. She is 12 years old. Date of birth is October 19, 2005. She is female. History of the patient includes medical, dental, and family. First, the medical history. The patient is healthy. No history of illness and abnormalities. Second is the dental. The patient had undergo oral prophylaxis or cleaning on her previous dental visit. And lastly is the family history. There is no recorded illness and present condition between the patient's parents and relatives. So here's the photographic analysis. So alam naman natin kapag kukuha tayo ng photographic analysis or kukuha tayo is dapat merong neutral background, yung ears and hairline niya dapat visible. Walang earrings, walang lipstick, neutral body position, alam nyo na yan. So, bakit nga ba? So, first, ang head shape niya is dolichocephalic. Facial form, leptoprosopic. Facial profile is straight. Facial symmetry is balanced. Mentolabial sulcus is shallow. Nasolabial angle is normal. She has competent lips, and the facial pattern is dolichofacial because she has a long, narrow face. Examination of the nose, size of the nose, 1/3 of the face. Shape of the nose is straight. Shape of the width of the nostrils is bilaterally symmetrical. Here, yung facial proportions, alam nyo naman na yung pagkuha nito. Yung horizontal and vertical proportions, di ba? Alam nyo naman, pag vertical, 4 lines, yung una is yung sa hairline niya, yung sa pangalawa is yung glabella, yung sa third is sa subnasale, and lastly, yung line na last is sa soft tissue menton, alam nyo na yan. So here, the middle third of the face has the greatest measurement, followed by the upper third, then the lower third. Central fifth has the most width than the lateral fifths. Here are the intraoral photographs of the patient. Her lips are normal. The tongue is normal also. Floor of the mouth, gingiva, and mucosa are normal. Tooth mobility is 0 degree. So here is our diagnostic cast for the patient. And here is the cast analysis for both maxillary and mandibular. Una is yung intercanine width. We got 29 millimeters sa maxillary and 28 millimeters sa mandibular. It was measured using a compass, cusp tip ng 1.3 and then 2.3. And sa mandibular naman is 3.3 and 4.3 measured by ruler. Second, intercanine parameter. We got 27 millimeters on maxillary and 30 millimeters on mandibular. Using brass wire naman siya, fina-follow yung contour ng mesial ng 1-3 and then 2-3. Sa mandibular naman is 3-3 and 4-3. Sa next is our arch length. We got 30 millimeters on maxillary and 30 millimeters and on mandibular. Both measurements are the same. So we got this in a bisection of horizontally ng dalawang first molar sa upper, which is 1-6 and 2-6 mesially. And then perpendicular siya sa midline. Ganun din sa mandibular, which is mineasured naman yung mesial naman ng 3-7 because 3-6 was already extracted, and sa 4-6. Next is arch perimeter. We got 75 millimeters on maxillary and 66 millimeters on mandibular. So, finalo natin yung contour using brass wire. Mesial ng 1-6 and 2-6 and mesial ng 3-7 and 4-6. Again, and extracted na yung 3-6. That's why sa 3-7 as tayo nagme-measure. And lastly is the arch width. We got 44 millimeters on maxillary and 47 millimeters on mandibular. So using compass, central fossa of 1-6 and 2-6 on upper, and 3-7 and 4-6 on lower. Steel cast analysis. Classification of malocclusion is class 1. Overjet is 3 millimeters. Overbite 2.5 millimeters. Dental midline is 2 millimeters deviated to the left. Palatal vault is normal. The arch form of both upper and lower are normal.